Dr. Dill here, and today I'm going to talk to you about fillers, dermal fillers, and in particular lip fillers, as there seems to be quite a demand for them at the moment. So today we're going to talk about what you really need to know prior to having lip fillers here at the MediShed. So let's talk about lip fillers. Now, done well, lip fillers can really enhance someone's face. Lip fillers are, however, a clinical procedure and they definitely require an artistic eye. Now, we all know that it's all too easy, unfortunately, to spot badly done lips. It's important that the lips should fit your face nicely, have a really good balance, and the proportions not be too overpowering. So as an example, if a patient has really big eyes, really big features, they may be easier for them to have look good with having bigger lips. However, somebody who's got smaller features may need smaller lips, i.e. they need to be in proportion with your face. So I always look at my patients in profile, i.e. from the side, to see if they have any asymmetries, or could their lower lip be augmented more rather than their top lip. So, look at the lip from all directions to see which areas could be improved. There may be many issues that can be addressed. For example, we could address the volume, that could be enhanced, the Cupid's bow could be redefined, the smoker's lines could be reduced, the vermilion border, which is the border of our lip, can be strengthened, and hydration can also be increased. Now, that is a very common complaint of many of my patients here, especially patients who are perimenopausal and have noticed that their lips are starting to feel quite dehydrated over time. I think the key to producing a really good result for the lips, as it's a difficult procedure to do well, is having really good anatomical knowledge. So an injector can understand the areas of the lips can be injected safer and which planes to inject. It's really important that hyaluronic acid fillers are used and that the reversal drug, i.e. the drug to dissolve the filler, is available on site. Now that's called Hyalase. For any reason the filler may need to be dissolved, it's really important for the injector to have this on site. So make sure you check. So what is the process here? The process here would be that all patients at the MediShed would need to have a full consultation prior to any filler treatment, whether it's lip filler, cheek filler, any filler anywhere else, and a cooling off period. I will take full medical history and advise you of the risks and the benefits of the procedure before making a recommendation of the most important, appropriate sort of lip filler that would be good for you. That is really important, as there are different products available for different needs. I here personally tend to use a mixture of products from the Belotero, Juvederm and Teoxane brands. But obviously within the brands they've got different types of fillers, so it's really important that your injector knows which filler would be good for you. All appointments are a minimum of an hour to allow time for topical anesthesia to work. And during the lip filler procedure, I'll be regularly consulting with you so you're happy with the outcome as well, okay? So it's a two-way process. It's, however, impossible to know how your body will react to the product and the procedure. I always inform all patients of all possible outcomes so that they are empowered with the knowledge, so that if there is a complication, we or myself together would be able to act on it. You will have a safer, more informed and stress-free recovery if you're aware of the commonly occurring and the more rare complications, which is why consulting for me is really important. The injecting part, it tends not to take as long. However, what does tend to take longer is explanation. Aesthetic treatments such as lip fillers are a medical procedure that can take some time to settle, but each person is different. So for the most optimum effect, you may need to return within a fortnight. I see all patients at a 2-week or 4-week review, depending on the area that I'm injecting. So let's talk about some tips prior to treatment. Ideally, please don't exercise beforehand. Don't take aspirin or ibuprofen for a few days before treatment. You could consider using arnica the week before you have your treatment. And when you do attend your appointment, have the lip or whichever area is being treated clean and makeup free. Avoid using makeup for the rest of the day if possible, and ideally no alcohol 24 hours before and after the treatment. So I'm going to talk a little bit now about complications and what are the common complications. Now, depending on your injector, they may be using needles or cannulas. Bruising can be common, so it's not uncommon as we are using needles. Bleeding and swelling can also be common. Nothing to worry about, but it's a common thing that can happen. Hyaluronic acid fillers attract water to the area, so when you place the filler, you can get a degree of swelling. Slightly more rare, you can get something called a hematoma, which can occur in, say, 1 in 10 patients, or much less than that. And over the rest of the couple of weeks, that will tend to settle down. Excuse me. Post-advice treatment. So after the first couple of days of your treatment, try not to rub or massage your lips. Don't take any ibuprofen. Avoid alcohol if you can, and you can be using also a cold compress that you can use on your lips every 15 minutes, every hour. Ideally, you could also sleep with your head elevated. Swelling is most noticeable in the first couple of days after your treatment, but then it tends to settle after that. Bruising can take a little bit longer to settle down. But I think, you know, what's really important is to be in contact with your injector if you're worried about anything. Now, rare complications can include things like delayed onset nodules. This is when a lump presents weeks or possibly months after treatment. That can be inflammatory or non-inflammatory and may need possible removal or antibiotics. Again, this is a rare complication. Very, very rare complications can include something called vascular occlusion. Now, you may have heard about this, and this is down to where, say, the blood flow is interrupted due to some filler blocking or putting pressure on an artery. Again, I do stress this is a very rare complication, but your injector and I would go through what to expect if that was a case, and we talk you through the signs and symptoms of it. Again, it's really important to be in contact with your injector, even after your appointment time, so that you know what would be expected. All patients that come to the MediShed are taught how to check for something called capillary refill. Now, this is when you press on an area of your skin for 5 seconds to see if there's any delay in the blood flow. It's really, really important to understand that these complications are rare, but if a vascular occlusion does occur, I will keep you in clinic and perform something called a Pylase pulse protocol until the blood flow is restored. Most importantly, again, I say stay in touch with your injector, and if you're concerned about anything, feel free to message them. They should be responding to your messages. And on a final note, after all that, please do not worry, you are in safe hands. 99% of the time, all is well, and my patients really enjoy the effects of their lip enhancement. It is good, however, to understand the procedure so that you're fully informed. Okay, take care. Hope that helps.